It's a Northwest News Radio weekend. IRG's Health Talk continues.
Our first guest is Dr. Nathaniel Wingert, orthopedic surgeon specializing in hip and knee reconstruction, talking about robotic surgery and total joint surgery. Shannon, these things have come so far. I had my knees replaced in 2000, and the strides that have been made since then are astronomical.
Oh my gosh, Tom! I started doing this physical therapy stuff 35 years ago, and in 35 years, the technology, it seems to kind of change every 12 months. And the technology used in robotics, robotic assisted surgery, and things like that, minimal invasive surgery outcomes. I mean, it's phenomenal. And Dr. Wingert is going to talk about kind of what he does in his practice as a total joint surgeon.
Shannon and Dr. Nathaniel Wingert.
Dr. Wingert, how are you?
I'm well. How are you?
I'm doing great. Thanks for joining us here on Health Talk. We're excited to talk to you about what you do. You're an orthopedic surgeon with a fellowship in total joint surgeries, and I want to chat a little bit about that and kind of talk about your practice, maybe how you got interested in becoming an orthopedic surgeon, and maybe a day in the life of Dr. Wingert. Let's do that. Let's set it up. Tell us about you.
Sure, that sounds great. Well, I'm a Seattle guy originally, grew up around here, and grew up around my father working on exhibits and art pieces and working on cars and all kinds of mechanical things. And I was more of a knack for science kind of a person and kind of pursued the doctor route with some great mentors and things, but kind of found myself interested in joint replacement and orthopedics because it has that sort of mechanical kind of a side to things that I kind of grew up seeing a little bit. And, when you really get into it, it's a very satisfying career because you have an opportunity to directly impact people, by doing something with your hands, by getting a surgery just right, whether it's fixing a fracture or replacing a knee, you can really make a big impact on somebody in a positive way. And it's a gratifying thing to do, and it can be fun sometimes too.
Yeah, it's an amazing how advanced the techniques and some of the procedures and the implants and the prosthesis, everything you guys are using, and then the minimally invasive surgery, the robotics. I mean, it's come a long way. Tell our listeners maybe about your training and particularly maybe your fellowship training in total joint surgery.
Yeah, you bet. So I spent a year in Salt Lake City, Utah, working with some great folks there, Chris Pelt and Chris Peters and Jeremy Gilliland and folks like that. We did all kinds of surgeries, 500 or 600 about in a year. It was a busy year, and we did first-time joint replacements and third and fourth-time joint replacements even. So some really complicated cases too, and those can be rewarding as well. But the field of joint replacement has really come a long way, and a lot of changes just in the last few years. It's kind of a great time to be an orthopedic surgeon, and in a lot of ways a good time to be a patient because there's new options that weren't there just a few years ago. One in particular is robotics, something I'm pretty excited about. It's robotics in one form or another have been around since maybe the past 10, 20 years, but they've gotten a lot better just in the last few. And it's with all the advances in technology and on assembly lines and things like that, some of these things are starting to come to operating rooms, and that's an exciting thing in a lot of ways.
How does a robotic intervention or the robotic procedure enhance your ability to provide that surgery and outcomes and maybe the minimally invasive aspect of the surgery in today's world? But I think it's important before we talk about it to emphasize that you're still in charge of the surgery. The robot's not doing it. I mean, tell us about the robotic use.
Yeah, it's a good point. The surgeon's very much always in control of the operation. Ultimately, a robot in the operating room is a tool at the surgeon's disposal. And so, I think when sometimes we hear robot, we think, like something in the movies and something that looks like a human, and it's really not that. It's something a little bit more like, you might see at a Ford assembly line. It's a robotic arm and it's attached to a computer, and really what it allows you to do is to position instruments and make incisions or cuts in bone specifically that are more precise. And we think, and we're starting to see results, that can lead to more precise outcomes and potentially happier patients. And that evidence is still emerging, but we're starting to see some of it, and it's neat to see.
And did you use robotic surgery in your fellowship when you were doing training? Was that part of your training then?
It was not. It was still new enough that it was still emerging. So that's something that I've developed just in the last couple of years. That's kind of how new it is as far as kind of really hitting the prime time here.
More on hip and knee reconstruction with Dr. Nathaniel Wingert and Shannon O'Kelly coming up next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
We continue with our conversation with Dr. Nathaniel Wingert and Shannon O'Kelly talking about knee and hip reconstruction.
Dr. Wingert, again, thank you so much for joining on us Health Talk here, and thank you for talking about what you do. It's fascinating, it really is. I've been doing this for 35 years, and when I first started seeing total knee and total hip patients, it has really come a long way. Maybe walk us through, from your perspective, a patient comes into your office, what is the determination to even do a joint replacement, and then what is the procedure and how does that work to kind of the outcomes and the patient returning to function? How about that?
Well, the first time I see somebody, really I want to get to know them personally, who they are and what's important to them and what's going on with them, whether it's their hip or their knee or something else, and how it affects their life. What's their unique situation. If you get to a point where that's the case, where you're missing out on more than you're participating in and not experiencing the things that you need to function in life, then we start thinking about a joint replacement. And usually that kind of happens over time, and we try all the non-operative things that we can, but sometimes we get to that point.
And when you do get to that point, what is the determination? I mean, how do you determine kind of the steps in the procedure?
Well, most people, so for instance, if you come in and your knee is hurting and you've never had a joint replacement before, the process is we'd talk about it and find a date and pick a time. And I do robotics for all first-time joint replacements, essentially, for knees in particular. And it's something that we'd set up. There's a preoperative CT scan, and you get three-dimensional imaging, and we can even review that when patients are interested. And you can plan out implants, so you can have a custom plan just for that person's anatomy where you plan the size and type of implants that go in, and you can manipulate those on a computer screen and plan down to 0.2 millimeters, believe it or not,
wow,
where exactly these components are going. So it's a pretty neat tool. You can be very precise with it, more so even than we could previously with manual instruments and cutting jigs and things like that, which still works great, but certainly the precision that you can get with robotics is hard to match.
Yeah, it's amazing. It comes down to really, I think you mentioned this, is really quality of life. Maybe let's talk about kind of what people can return to with the new technology and the minimally invasive surgery, the quicker, better outcomes. You can return to pretty high-level functioning activities.
You can. I've got patients that, have gone back to coaching soccer and going on long hikes and sent me pictures from far off parts of the world and, hiking and biking and climbing and things like that. It's probably one of the most rewarding things that I'll get sometimes are pictures and stories of people enjoying improved lifestyles and doing exciting things.
Yeah, it is amazing. I'm interested to see what the next 10 years bring. Dr. Wingert, again, thank you for your time. Thank you for the information. And thank you for the passion that you provide your patients in healthcare. That's awesome.
You're very welcome. Thank you for the time.
That's been Dr. Nathaniel Wingert talking about hip and knee reconstruction, robotic surgery. You can get more info at ProOrtho.com. Shannon, as we mentioned at the top of this segment, the gains, the progress that has been made in this has just been unbelievable. It's almost like sci-fi movies sometimes.
Oh, it's amazing. I have a buddy of mine in his mid-50s, had his hip replaced like 8 weeks ago and is out on the golf course already and looks great, So the technology, minimal invasive surgery, outcomes, it's just really impressive. Don't sit out there. Don't sit out there and live in that joint pain and dysfunction. If you can get your hip replaced or your knee replaced, there's options for you.
Yeah, it can really be life-changing, that's for sure. All right, thanks to Dr. Wingert. Our next guest, Cynthia Warner, next after this time out on Northwest News Radio.